better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise,
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.
Welcome back to everyone to No One Told Me. Liz and I are super excited today to host I know this is going to sound cheesy, but friend and mentor, Dr. Staci Whitman. Staci, we were just talking about how you have so many things going at all times, and you were sharing with us that you love to be a creator and in the land of creativity. Tell us a little bit about yourself. Give us a little bit of a background onto who you are. What gets you ticking?
Oh man. Well, thank you so much for having me. I'm a fangirl of both of you too.
Oh, very generous.
Power in numbers, ladies. About me, well, quickly, I grew up in rural Maine. I couldn't wait to get out of there.
There's not many of us. There's not many of us.
I
I'm
know
from
that's
here
a
too,
connection.
so.
I forgot. I always forget that.
Yeah.
I could not wait to get out. I constantly was like, how do I get out of here? And
It's not the most health focused area. Like
I
Big
guess,
G's sandwich shop is like the best place there is to eat healthy food.
yeah, I just
Which
never
doesn't exist here.
felt like I fit in. I didn't belong here. But anyway, there's a reason I was born and raised there, of course. But so I was always interested in performing. I grew up a dancer. My first job was teaching toddlers to dance, and I was in theater. I was a theater kid and really into music and etc. And I loved science, but I never aspired to be a dentist necessarily. I was the first in my family to graduate college. So I didn't really have any mentors that way. I had a really terrible bicycle accident when I was 10, and I avulsed four permanent teeth, my four front teeth, and I fractured all my lower incisors. And so I was in and out of dental offices and orthodontists and oral surgeons forever. For at least 8 years until I was 18, and got more permanent prosthodontics done. And so with that, I learned how dentistry could be a little bit creative. I wanted to go into oral maxillofacial prosthodontics, so like replacing body parts, faces, ears, eyes, noses. A fun fact about me: when I was a kid, I wanted to be a horror movie makeup artist, so that just ties into all of it. Meaning I just loved to create and to transform. So I got into college, I was an art major, and I was like, I need to get out of Maine, and I can't sleep on couches and be a struggling artist. So I did a 180 and I switched from an art major to pre-med. And I thought, well, maybe I'll go into dental school because I know a lot about that because of my childhood experience. And so that's literally how it happened. Because I thought, well, I'll still work with my hands. It's a little bit of sculpture. And I never really felt like I belonged in dental school either. And I always questioned the way we were doing things. I
Well, we
did,
both went to Tufts, so
yeah.
I was like, I'm in the wrong field. Like this sucks. I'm completely not doing what I thought I would be, which is like healing the body. It was so much tooth mechanics. So no offense, but dental school needs to change a lot.
It does. I think it needs to be longer. So I feel the same way. Like I kind of, you don't know what you don't know, but I knew it never resonated with me. And I just wasn't as into it as my classmates were. And I thought I tended to leave a cleaner lifestyle myself. I was always into health and nutrition. I was like, why are we just constantly putting out fires? This isn't rewarding for me. But okay, I'm going to put the blinders up, heads down. I'm going to graduate. I'm going to learn to do, pass my board exam, etc. So I graduated, and no surprise, I was miserable in dentistry. I hate it. I really hated it. But I had this huge student loan burden and all this time spent, and I kind of had to force myself into it. And then I moved out west just out of the blue. I packed up things from Boston and I moved out to Portland, Oregon, um, in the hopes of finding something new. And sure enough, I didn't quite yet. It was the same thing out here, of course, no surprise. And then I just thought, well, how do I get more upstream? I'm tired of the disease and the chronic perio and the full mouth rehabilitation and the full mouth extractions and the dentures and this end stage whack-a-mole. How do I truly help my patients heal? And I thought, well, gosh, that's going to be with pediatrics. I have to catch these kids and their parents before the chronic disease cycle starts.
Yeah.
So I went into pediatrics not because I'm an enthusiast of children. Of course, I love children, but that isn't why. It was because I was trying to salvage my career. I was really trying to think, how can I find joy in this field? And then got my board certification in pediatrics, got very interested in craniofacial development and airway health and sleep. But no surprise, again, as an associate, I was dissatisfied because now in pediatrics, it's even faster turn and burn. I mean, you see 2 to 3 times as many patients. You have even less time with your patients to connect and work them up and help them figure out their health journey. And so then it was just a slow evolution through reading literature and books and connecting and taking courses. And it took years, and I'm arguably still in the middle of it, of transforming my practice model to think more whole body root cause systems biology, or for a more functional mindset. And interestingly, when I started to incorporate these principles into my office, my patients got healthier. We ended the disease cycle. These kids weren't repeat offenders under general anesthesia. Their parents would come in reporting, my gosh, their eczema is improved because you mentioned this, or they're off their ADHD medications because we work them up in this capacity, and you peel back the layers slowly. But all of this was really just done as a survival mechanism to save my career for me. But now I really do find such true joy and passion, and the reception's been so great by not only patients but the dental community too, because I think so many of us suffer the same thing. We're burnt out and we see the issues, but we don't know how to fix it because we're kind of stuck in this hamster wheel. And we're so busy in our practices. It's really hard to take a step back and say, how could I do this differently? Where do I find the education to even begin? And so here we are.
And there's
But
also
that's not, you've transformed not only your career, but I mean, you're transforming the profession with the beginning of the Institute for Functional Dentistry. Like, this is such an incredible time for you, but also for our profession as a whole.
Yes, thank you. Yeah, that's been a labor of love. So when I first was introduced to functional medicine, it was probably like 2015. I knew of Dr. Mark Hyman, et cetera, but I wasn't fully entrenched in it. I read Dr. Stephen Lin's book, The Dental Diet. I became familiar with Weston Price's work. And I just found that so interesting. And I always was super into food and nutrition. I myself love to cook. I'm a creative, right? So I love to cook, and I love the science of food, but also nutrition and how we can optimize that way. And then, of course, no kidding that oral health issues can be tied back to what we're putting on our fork and our spoon in capacities other than just avoiding sugar, right? So the Institute, it's been an idea I've had for many years, and then no shocker, other people have also had the same idea. So the universe brought us together. I can't take credit for all of it at all. It's been a very heavy lift. I'm one of the co-founders, along with Dr. Mary Ellen Chalmers and Dr. Valerie Cantor. And we just launched last week the Institute for Functional Dentistry, and it's a place for dentists who want to practice a little differently and zhuzh up their practice, I would say, for better patient outcomes, to go in one cohesive entity instead of like what I did, which was piecemeal, flying all over the country. I mean, it was insane what I did to educate myself. Because we know it's so hard and it's self-paced, it's all online because we want to be respectful of private practice and professional lives and family lives. And we have a killer faculty, of which you're involved, Dr. Turner.
Yeah, I'm so
And
excited.
Yeah, thank you. And the curriculum's amazing, and it's open to hygienists and auxiliary team members, myofunctional therapists, chiropractors, craniosacral therapists, front desk assistants, physicians. There's different tracks, and it's all founded in functional medicine. So you do take the Institute for Functional Medicine's basic courses, and it depends what track you are enrolled in. You may take additional courses, but to your point, dental school, I think, is missing a lot. And I just think it's too short. And I know that upsets people because when you're done, you want to get out of there. But I just think we need a longer educational experience. And part of that is because so much of dentistry is we're doing microsurgeries every day, right? You have to learn how to do scaling and root planings, and you have to learn how to do class, all these different fillings and crowns and root canals and oral surgery and surgical procedures, et cetera. God, now we're screening for airway and how do we fix those things, orthodontics. It's a lot. Our profession, people don't realize how involved dentistry is, especially if you're a general dentist and you're doing a little bit of everything. It's incredibly involved. But what we're really missing is systems biology and medicine. We get a little bit of it, but not nearly enough. And so it wasn't until in 2020, I went through the Institute for Functional Medicine certification program. So I went through their board certification program, and I, I'm not going to sugarcoat it. It was incredibly hard. I mean, it was very humbling for me to go through that. And I realized I don't know anything. I don't know anything about the way the body works or is connected. And so it became hard when I graduated to figure out how to apply that to dentistry necessarily. And that's where the Institute will come in. It will kind of do that for you. But you don't know what you don't know. And going through that program made me realize how much more we could be doing to help our patients.
And you
Yeah,
mentioned when we
it's
were setting this up for, we were talking about what we're going to talk about, and you mentioned, burnout, and you think about from the perspective of um, a general dentist, you're coming out and you know so much about so many different things, but then you realize you don't know enough, and you feel like you have to be an expert at every tiny nuanced detail, and it's happening at such a small micro scale, but it's just exhausting. And you don't have the time, the energy, or the resources to continue learning, and there's no clear path of where do you go next. So like what you're creating is giving this breath of fresh air of here is your path. Here is how you can do it in a way that makes a lot of sense for whatever journey you're on.
Yeah, yeah, and every specialty is covered in there too. People are asking. I mean, there's an endodontic section, there's a periodontic section, there's the oral microbiome, nutrition, labs. So I encourage everyone, if they're interested in listening, please check out the curriculum so you get a better understanding. That I guess I never say this when I'm asked, but that is maybe not maybe, that is partly why I specialize too. So for me, I like to feel very confident in what I'm doing. And with general dentistry, I just felt like I never knew enough about anything. I'd get my journals and I was like, what do I read about? Do I read about endo? Do I read about perio? Do I read about I don't know. Where do I even begin? I was overwhelmed because I wanted to be an expert in my craft in my field, but with general, hats off to general dentists. I mean, it's really hard. And I think it's asking too much a lot of times. I mean, I really do like to try to, I believe people should focus in what brings them joy and passion and where they thrive. Um, but what's interesting with functional medicine and dentistry is once you get a hang of it, you don't need to uproot your practice. You can implement these concepts into your existing practice. The only caveat is I would say your intake form and your new patient exam should be more involved. So you might need to lengthen time, but this is where you train your auxiliary team members to do a lot of this education and workup for you. I'm a big believer that I think we should have health coaches in our practices. So I'm trying to work toward that movement too. Um, but this is why we've opened the training program to other team members too, because you need a cohesive, everyone needs to be on the same page to make it happen, right? It's like it's a performance to me. I'm a theater kid, right? So we all have to work collectively together in the office to create the best patient outcome. Um, so yeah, I mean, our goal is to help certainly change the profession. It's not meant to replace anything. It's supposed to be complementary. But I think many people will find when they have more education, they'll be able to help support their patients better. And and then they'll see true healing in their patients. And that it's so rewarding. I mean, it's so rewarding. And the burnout does go away because now there's so much gratitude. I feel like dentists, we have it hard because people hate us too. Like no one wants to be there. We are quote unquote expensive and inflicting pain. And, no one wants to go to the dentist. We're the brunt of the joke in songs and movies and everything. And I think there's a little bit of truth to that because we're just putting out fires constantly. We're just constantly maintaining disease,
Yeah.
right? A lot of times. And so, what if you actually get your patient healthy? I mean, how rewarding is that? And people are like, well, what would happen to my practice and productivity? You will be so busy.
Mhm.
Right.
You will be so busy. Patients still need to come to the dentist. They need to come in regularly for guided biofilm therapies and their dental checkups and et cetera, and cleanings and what have you. But I don't know. I encourage everyone to at least look into it. It's just changed. It's been so impactful in my life, and I'm so much happier now because of it.
Well, it's interesting in our training. Like I was at a wedding this summer and I was introduced to another dentist. And the only question that that person asked me was how many all on fours do I place a month? And I was like, none, because we work to prevent. You're working towards correcting end stage disease.
Yeah.
Yeah, it's just incredible what you've created and what you've done. So, we have a lot of parents that listen to this as well. And I think from your perspective as a pediatric dentist and looking at functional whole health, what would be three pieces of advice that you would give to new parents kind of in the dental space? There's so much confusion like, when do I even bring my kid? What should I be looking for? What kind of toothpaste do we use? All that different stuff.
Okay, well, the first thing is I want you to really prioritize oral health. I think um, oral health has always been in the shadows or kind of an afterthought. And many of us were just raised that way, but we're learning now it is truly the gateway into the body. And it starts the moment your child is born, arguably before they're born, because the microbiomes are established preconception. This is a whole conversation we could get into, but uh,
Even birth and delivery, there's so
yeah.
much.
And breastfeeding and skin on skin contact and food introduction, environmental exposures, etc. So it's really important and to take it seriously, but it doesn't have to be a heavy lift, the getting back to the basics. So I do like parents to see a dentist by the age of 1. If you're listening and you've missed that mark, don't panic, but get in soon. And the most common question is, well, why? They're just baby teeth, or what are you going to get done on my 2-year-old? They're a squirrel, they're all over the place. You have to trust that we know how to work with this age group. I do recommend to see a pediatric dentist. I mean, the additional training we have, if one's accessible to you. There's a lot of great general dentists too, but many general dentists will say, not my thing, right? Like,
Well, and
I
even
don't,
the environment of the
yeah,
office. I see children that age, but in our general practice, it's it's lovely. There's not like balloons
yeah.
and fish tanks and clowns, and I don't expect that from pediatric offices, but like if anybody hasn't seen pictures of your office, like your office is beautiful, and it's just a very inviting environment for a pediatric population. So for a lot of us, it's not that we won't see children, it's just like part of the goal is to help them feel comfortable in the environment, right? To help
Totally right.
them feel like there's a joy in going and not a fear that we
Well, and
instill.
sequentially too, right? Like you're starting to build trust in these like little deposits of positive interactions as opposed to waiting until they're 3 years old. Now they have fear or they base that on exposure to the pediatrician. And now we're really actually quite
For
scared.
sure. And as parents too, we like project like, oh, don't worry, they're not going to give you a shot. It's like, who even says that? Come on.
Oh
So,
man, we have
yep,
a do and don't say list that we give to the parents ahead of time.
that's fabulous.
Yeah, so the kids are smart. They know like, oh, this environment is for me or this is a grown-up space, right? And that you're right, that influences their perception. So anyway, I like to see kids by one. I mean, I ideally, because I am airway focused, I like to see them even sooner, sometimes in infancy or above. So that's the next thing I would say is let's focus on airway health. And so more and more dentists are on board with this, which is wonderful. But making sure your child's breathing optimally. Are they breathing through their nose? Are they mouth breathing? Are they constantly congested? The eczema and allergy and asthma issues that we're seeing often are not it's inflammation. It can be microbiome imbalances. So looking at gut health first and looking at the system of the child. And this is where we need this additional training so that dentists can help guide. Um, so really making sure you're going to someone ideally who can help check a lot of boxes for you. I think it's important. Food introduction is my next big push. I mean, we have to be getting back to whole foods, um, and fermented foods and supporting the microbiome and less of the ultra processed and less of the preservatives and you know, the sugar and the flour and all of that. And the longer you can prevent your kids from being exposed to these foods, it's just going to be better for them. My girls are 10 and 12. I was pretty strict. I was never neurotic about it, meaning like obsessive, but we were pretty strict. We didn't bring those foods into the home. But once they get to school, inevitably, and they're on sports teams and they're at friends' houses and they're going to get exposed to this, but you've laid the foundation. And what's really important to know as a parent, there's something called the first 1,000 days, which is roughly about 3 years. That can be include pregnancy, but this is when the microbiome is being established. And so the first two, I would go up to 3 years of life, are foundational for food exposure, microbiome development, palate development. Like, what are they going to start craving? Are they craving sugar because they're exposed to it so frequently, or do they crave savory? And are they okay with sauerkraut and, a wider range of different polyphenol rich vegetables and foods and things? And I speak to a lot of this on my page. So getting into the dentist early and um, in food introduction is critical. I'm not in one camp per se, but I do like the concepts behind baby-led weaning. So, educate yourself around that. I did a mix of puree and baby-led weaning with my girls. I don't think anything in life is black and white. We all go through different phases of life. We're all bio-individual. I believe in the 80-20 principle. 80% of the time you try to do, what's right, what's kind of quote unquote perfect, and then the other 20%, or you could say 90-10%, it's going to be okay, right? At the end of the day. The last thing I might say is, and this is a strange one perhaps, but I really believe in trusting your parental instincts. Um, I don't think it gets talked enough about how, we as parents, we know our children better than any provider. And so if you feel something is wrong, but someone's telling you they're fine, like they'll outgrow it, like let's say an airway issue, or you're being shamed for your child's dental decay because you're breastfeeding, um, and you just know instinctively that that doesn't make sense. I encourage you to trust your instincts and be empowered to find a provider that works with you and listens to you and doesn't lecture to you. Um, I really believe that the patient doctor dentist relationship should be approached as a team and that we are educators and teachers. Um, and we're part of your healthcare team and we're guides. We're essentially guides for your journey. But with a lot of these issues that pop up, there's so much shame and blame and gaslighting, as much as that word's overused in medicine and dentistry. And I just I'm so team mom
Mhm.
with a lot of these conversations that just know there are providers out there that will support you. Um, and maybe you need some re-education, but there's just so much fear too among moms, and it really upsets me. And this is why I get so upset on social media with some of these very black and white fear-based messages. I encourage everyone, mental health is health, and just trust that you know what's best for your kids. Um, so that those would be my three.
Yeah,
Great
those are
questions and
great.
great answers. The whole time, like I can just see me and Liz like nodding along with you.
Like, let's get on our
Keeping beat.
soapboxes.
Well, I
Yeah.
think that the point you bring up about fear mongering and supporting moms is really important. And it actually is something that came up recently. I did a podcast, and then that was broken down into some reels, a series of reels about the connection of dysfunctional breathing, specifically upper airway resistance and sleep apnea and preeclampsia. And somebody really near and dear to me that I love reached out and kind of accused sounds dramatic, and it wasn't that dramatic, but kind of like pointed fingers like, hey, you're fear mongering and you're pointing fingers at moms. And and that was not my intention. It was more of a, hey, did you know that these things are connected? Anything that we do from an educational standpoint is from a place of empowerment and
Yeah.
trying to connect dots so you have the opportunity to make changes. And then also recognize that nothing is black and white. Everything that we're talking about is so nuanced. But I hate so much of the focus has been back at specifically moms and putting the guilt of everything on their shoulders.
Mhm.
Totally. Yeah. Yeah. It's so unfair. Mom, I mean, we have such a burden already, and we live in our own often made up guilt that's unnecessary. Like we don't need to add to it as a provider. It just kills me when I hear that a mom was blamed for her child's issues and like even said, I've heard providers saying you did this to your child. Like you need to stop. This is on you.
It's
I
ridiculous.
have heard that with my own ears. So, and I've been guilty of that too, like being called out saying that's a fearful message. And sometimes it does make me pause and I'm constantly working on my messaging, but to your point, it is a fine line. It's really hard to get the education out and just saying, listen, this is just meant so you can be a better advocate for yourself or for your child or um but there
Well,
I think we all know the certain accounts that it's like the ranting and raving talking head accounts, that my blood pressure goes up when I watch them. We have to be so careful now with social media, but that is where most people are getting their information from. And I think for anyone listening, I'm very involved in social media. Like I have a business there. That's my educational platform. It's a lot of algorithm chasing. You have to understand that. And so again, trust your instincts. Like this is where trust comes in. Establishing trust with your provider and your teachers in your life and your mentors. Trust your gut on that. Does this message seem to make sense? Does this resonate with me? How is this making me feel? Because I do see a lot of, I think it's a mental health epidemic among moms
for sure.
coming to my office right now. There's so much anxiety and fear of everything. And of course, that's never the intention. And I've changed some of my education and messaging as a result because I've realized some things I can learn about and I will take it with a grain of salt and just think, I can't avoid microplastics completely, so I'll do the best I can. But some patients can't. They really become obsessive about it.
Yeah.
And that's not serving anyone either. So just being very mindful how you speak to your patients and the words you use matter. They matter so much.
Mhm.
And so part of our training program is working on verbiage and called the therapeutic encounter, and that mental health is health and emotional health should be part of our practices. And the way I lead my practice now is it's emotional health first. That includes the experience of the child, that includes the experience of the parents. I think that's so much more important than their teeth. Think how many think how many patients have true PTSD or phobia of the dentist. This is another reason I went into pediatrics is I was in a practice, it was a Medicaid practice as a general dentist, and the stories these patients would tell having gone through the system, it was terrible. It was heartbreaking what happened. And it was always childhood experiences and that like the hand over mouth technique and being papoosed and essentially some stories are it's assault, I don't think this happens much now, but if we go back several decades ago, dentistry was pretty rough on kids,
Yeah. The
So
practice I was in before I moved out to Colorado and bought my practice was a fear-based practice. Like it marketed towards fear. It was the fear dentist, the TV dentist. If you have a toothache, you come here because we're we're here to help you. We have nitrous for everyone. And that was like the way that they would help them. So we were just putting out fires. But I would ask people, how can I make you more comfortable? And every single one would come up with a story from childhood. And one of the most dramatic I heard was it was a gentleman, and he goes, when I would go to the dentist, they were identical twins. And there were two dentists, and one was super nice, and one was super mean and would hurt you intentionally. And he goes, and you never know who you would get until you opened your mouth and they started working on you because they looked exact same. Like, what a terrible horror story
What?
this is. But we have such an impact on the way that we're perceived as people grow and age. But I mean, to your point of the mental health being such a big aspect, like we see it all the time in the airway and oral ties space. There's just this fear, like, what if my baby has a tongue tie? And it's like, well, what if they do? Like, you could do something about it, or maybe you decide that this isn't the right thing for you in this moment. I remember being pregnant with my first and being in the hospital to deliver, and I'd elected to have a doula. This was like back before I knew that patients really had autonomy. It was just like, okay, you just go with the system. And I remember very vividly my doula saying, there's very few things that are a true emergency where you can't take 3 minutes
yeah.
to sit and think about what you'd like to do. And that really resonated with me because I think in so much of health, we feel like we have to make an immediate decision. And it's like, just take some time to process the information, do your own research, learn the other side of it. You don't have to rush into anything,
That
really.
includes treatment, right?
For
Like,
sure. Exactly.
I mean, monitoring cavities. Like, I wish I could just teach people, show people how we are over treating kids.
Mhm.
Because it's how we're trained. I understand that. I was too. And it took a leap of faith and some risk, right? To say, well, what if I just watch this and I educate the parent, maybe we make a few tweaks with hygiene and diet. What if we just monitor this? And it's been eye-opening
Yep.
how not only does the body want to manage itself, it wants to heal and stabilize and balance, but especially in pediatrics, the baby teeth do fall out. I mean, these are practice teeth, and I'm not trying to downplay pediatric specialty. These teeth are very important, of course, for occlusion and mastication and airway and all of this facial development. That's not what I'm saying. But how many children undergo general anesthesia a year to have primary teeth fixed? And I get a lot of second and third opinions at my office. And some of the decay, you're just like, these are incipient lesions.
Yeah. Control the microbiome,
And
slow
and
it
their
down.
their treatment plan for 8 stainless steel crowns under general anesthesia, and it's a motivated family, right? So it's like, what is happening?
Yeah.
We've lost sight. We've just become too robotic. And so the whole point of the Institute of Functional Dentistry really it's a reset. Um, it's to empower providers to start thinking critically again. We've gone through the motions for so long. It's hard. It's a re-education, but I think most people want to be there. They're just feeling stuck. So, um, yeah, we could talk forever. We have
Oh,
so
it's
much.
such an exciting time.
I know. I know.
Well, and you've developed, I mean, the faculty that you have on your team is so incredible. And to have it be self-paced, like I think it just gives us as providers that exact opportunity that we have been looking for, which is a reset. That was one of the reasons that we established our airway course and our phorectomy courses. Like can just become so jaded in your profession. I remember Frank Spear giving an incredible lecture a few years back, and he was talking about like the climb in your career and then this like downfall where everything's falling apart. And then it's kind of reestablishing what you want your journey to be and finding that vigor for it again. And like that's where you find the true happiness in all of it is you're actually healing people and healing yourself. So there's the mental health component as well for the patients and for us as providers. Like
For the
it's
For
providers.
the
yeah,
providers, yeah.
Totally.
it's hard to go to
Yeah.
work and hear everybody hates you.
Yeah. I
It's
mean, you work.
rewarding to go and say, here, thank you, you know?
Yeah.
Mm.
Yeah. And like to your point, yeah, how do you reestablish yourself? It's always through education. You always take a class and you're like, whoa, laser dentistry is so interesting. I'm very into that. Or I want to get more into full mouth rehabilitations or, whatever it might be. And then you really find your calling. I think you just kind of niche down. I think it's great. But again, the foundation is so critical. And what's cool about functional health is you can apply it to your life and your family and your friends. I mean, it transformed me when I went through my functional medicine certification. And again, it was during COVID and, we were all mandated to be closed and I was working 5 days a week, 8-hour days, just in clinic, 100+ new patients a month, running the practice. It's my personality to not, I'm a people pleaser. I never say no. Coming in on Saturdays, I was so burnt out. And I look at photos of myself. I was so inflamed. I was so sick.
Mhm.
And so to me, COVID was a blessing because it forced me to stop. And I had to look in the mirror and be like, who are you? You're lost. Like you're physically lost, you're emotionally lost, you're spiritually lost, your career, like what are you doing? And I found functional medicine and it changed not only my career, but my life. I figured out things about my body that I really believe if I hadn't done a gut mapping and a hormone panel and micronutrient testing, I was headed towards autoimmune disease. I was absolutely headed towards that. So it can help you too, which is really cool.
And we always say that, like, once something becomes personal, it's impossible not to be really passionate about it. And you want to spread the word. You want to like tell everyone about it.
I love it. Power, yeah, it just and it spreads. We all want, I think we're all realizing we're in this really cool moment where I think we are all realizing that health and time are our most precious commodities. Um, and everyone wants to be healthy, but not everyone has the ability to understand what that means, the support team to get there, the education to even understand what's going on. But I really believe that innately the body wants to be in balance. We want to be healthy, we want to thrive. And if we give the tools that we need to the body, we can get there in time. And so I think dentists are such a powerful field. I really do. I think we have such an important role in health outcomes. And I know we've kind of been, like I mentioned, the brunt of the joke, but I encourage everyone to shake that off and say, no, no, we are the gatekeepers. I mean, the mouth is the gateway into the body. It really is. And especially with all the new research coming out about the oral microbiome, I want you to own that, you know?
Well, and especially where we have been separated from the rest of the body, I think there's always just been this level of, oh, well, you're not on the same level. Like you guys aren't on the same level. So why do we even care about the mouth? Like it's just teeth. Like we can just replace them. But I think that's one thing that the Institute is going to do is give us further credibility as a profession of, wait, you have to listen to us too, just as much. Because I think that's so much of what we hear from our patients is, well, my pediatrician said, my
Right.
doctor said, and it's like, okay, but are they following the research? how do they know? What was their training in this space?
Right.
And so I think it just allows us a better eh, foothold in the medical community as a whole.
It adds credibility, absolutely. And so many medical providers, whether it's functional medicine or naturopaths or your standard provider, I think they're realizing the mouth is missing, but they don't know where to begin. They understand the concepts, but then who do you refer to?
Mhm.
They certainly can't manage gum disease, periodontal disease, airway. Like, yeah, I think you have airway issues. Okay, now what?
Mhm.
And so it's cool with the program too, is that there will be a database, and it's going to be a very cool database, unlike any other group, in my opinion. It'll be very interactive, and it's going to link people to other providers too. So functional medicine, myofunctional therapists, etc.
Mhm. I am sure it's been just a labor of love. And I remember it was lucky enough to meet and spend some time with Dr. Val Cantor back earlier this year and just hearing about what you guys were building, but even the way that she approaches endodontics and how different that is. The root canals have gotten a bad rap, and it's not necessarily the root canal, it's how the root canal is managed. And she, in her practice in California, brings it to a whole nother level. It's wild what she can do.
So what you said about root canal specifically, first of all, Dr. Valerie Cantor is incredible.
The craziest thing.
I've had root canals retreated by her. I flew down because she's so good. But it's not black and white, and there's genetic predispositions too that we don't speak about, or it's the terrain too. Like, is your patient healthy enough to have this therapy? Do they have autoimmune disease? I mean, that is a contraindication to some things that we do. So,
For sure. What's your body fighting?
yeah, exactly. And so we do tend to treat everyone the same in the office. And we should be doing more workup. Like, I think we should be comfortable ordering and interpreting certain labs that are within our scope, you know. Vitamin D deficiency is, we should, I don't know. I could go on, or blood sugar,
Yeah.
HbA1c, iron levels, vitamin C levels. Think about scurvy. Who talks to their patients about vitamin C deficiency? So, and again, these things aren't heavy lifts. It's just restructuring the way you're thinking in these little ways to kind of put the pieces together. Um, and you will have better outcomes too, because the no amount of scaling and root planing is going to fix vitamin C deficiency, you know?
Totally.
So, yeah.
Oh, well, Stacey, this is so helpful. Thank you so much for sharing your message and all you've done for our community, just in dentistry as a whole, and all you've done
Session,
for
yeah.
patients. I mean, your platform too, you just bring so much awareness and accessibility to information where other people aren't. And I think keep doing what you're doing because it's really made a difference for, I know Meggie and myself, but just for the population of human beings. And hopefully we can still keep going in that direction.
Oh, we will. Lots of collaborations to come. Thank you for your kind words. That means a lot. Um, it brings me true joy. So I think foundationally, I'm an educator. I'm a
How many times have you heard the joke, well, why do you need dentists up in Maine? You guys don't have any teeth. I'm
Yeah,
like,
I know.
okay, heard that one
Okay.
before, Bob. It's pretty
How many,
funny.
excuse me.
Oh.
Do you still get recruited back to me? Because I keep
Oh,
saying,
well, my mom, she like, small town, right? My mom was like, oh, free dental care for Lit from Liz for anybody who's ever been
I
nice
know.
to her.
Yeah,
And so like I'm like, I couldn't even, I love where I grew up. I'm lucky I'm from coastal Maine
yeah,
and I have I just love the state, but I am so glad I live out west. And there's just a different kind of philosophy in health, and
yeah,
I feel lucky all the time to be in a community where people value it more
yeah.
than certain other places.
We'll get there. It's all through education,
Mhm.
right? Everybody wants to be healthy. They sometimes just need to be shown the way. So anyway, thank you for having me. This was lovely. Please, if people want to follow along online. I'm generally on Instagram. It's Dr. spelled out underscore Stacy. I do try to answer all my DMs. So if you hear something that I said and it wasn't clear enough or you have a question, hit me up. I'll try to answer it for you.
We can link that as well as the information on the Institute for Functional Dentistry in the show notes. And everybody should really check it out.
Thank you. I hope so.
Thank
Spread the
you
word.
so much.
Thank you, ladies. This was
Stay
fun.
healthy.
Yeah, thanks.
All right, feel better. We'll talk soon, I hope.
Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this. And don't forget to subscribe.
want to learn more about airway health or connect with our team?
Please visit our website, untetheredairwayhealthcenter.com, or follow us on Instagram @untetheredairway.
Until next time, bye!